Okay. So now that you've seen me, what's going through your mind? What are you thinking exactly?
Yeah, good.
I'm good.
Yes.
Oh, thank you.
You
You're.
look beautiful.
Oh, thank you. Thank you very much. Also, you hear me, you listen to me all the time, but you haven't seen me.
Yeah, once in a while I listen to Star
Oh,
FM in the
okay.
morning, especially if I'm not busy or if I have somewhere to go and I'm driving in town.
Okay.
I'll listen to your time.
Right.
That's your
Okay.
the
Oh, that's
branch,
good to
and then I
know.
hear your name,
Yeah. And then
Natalia.
finally, you've seen me,
Yes, yes.
Natalia.
I never thought I was gonna meet you one day. No.
Oh, well,
Yeah.
today is that
Yeah.
day. Today is that day.
Yeah.
It feels good to
So
have you.
it's good to have you too.
Yeah, Dr.
It's good.
Owusu-Ansah.
Yeah.
So today we're talking about wellness care,
Right.
right?
Right.
This conversation comes up every now and again. But first of all, tell me, where are you from?
Okay.
And what exactly is it that you do?
Right. So, I'm from Healthy Soul Medical Center.
Okay.
So, Healthy Soul Medical Center is one of the alternative health facility.
Okay.
When you say alternative, we kind of using herbal,
Okay.
homeopathic, and then other stuff to manage chronic diseases.
Okay.
Yes. So that's where I am coming from. And
Right.
we at Kaneshi.
Okay.
It has been rated one of the best health facility or alternative health facility
Okay.
in Ghana.
Okay.
Because
That's
we
wonderful.
practice evidence-based medicine.
Okay.
And then you use the WHO mandated laboratory investigation to do our work. So you can't come to Healthy Soul without a lab investigation and then we'll just prescribe for you. You always have to get our investigations done and then we get them accurately before we prescribe or before we give you the management or the treatment.
Oh, that's wonderful. That's wonderful. I think I'll come and visit your clinic.
You have to. You
I-
have to.
yes.
You're actually running a promo or you're doing a package. That's why I'm here. So
Right.
probably
Well-
the
well-
whole of this month or the whole of this year, people will hear a lot about wellness
Okay.
healthcare approach.
All right. So let's talk about wellness care. When somebody says wellness care, what exactly does it mean?
Yeah, I'm sure we are all well
Yes.
because you don't have headache. I don't have headache.
Actually, I do have a little headache.
Okay. So
This morning I woke up
okay,
with a little
so
headache.
talking about wellness healthcare approach, we want to emphasize more on the non-communicable diseases.
Okay.
Because those are the things, or those are the area which you do not have the signs and symptoms early,
Okay.
unless it gets to certain stages. And when you do medicine, when it comes to the non-communicable diseases, we have them in stages. For instance, if you're having kidney disease, we have kidney disease stage up to stage 5.
Right.
We have it from 1 up to 5. And Nat, do you know that unless you are at stage B or 3B, before you see that your kidney is getting damaged?
Oh, right. I didn't know that.
Yes.
Okay.
Um,
So it starts 1, 2, 3,
3A. You will not
3A,
you will not see anything
Oh, right.
unless you get to stage 3B. That is why there are a lot of cases these days.
Okay.
And for Healthy Soul Medical Center, being in the field for almost 20 years, we've realized that Africa, Ghana as a whole, we are not practicing, this kind of
Wellness
approach,
care,
wellness.
yeah.
I live in other places, Europe, France like this, Germany like this. You'll be there every 3 months, depending on your age, you need to go for checkup. And then you go for
Right.
checkup for some of these things, non-communicable diseases,
Right.
liver problems, kidney problems, cancers, all these things. It's mandatory. If you don't go,
Right.
you have a fine to pay.
Wow.
Does it happen here in
No, it
our part
doesn't.
of-
No, it doesn't. And every time I say that, sometimes it's the economic factors, because there are some people who they would never go to the hospital unless they feel like, okay, I think I'm going to die. That is when they would go.
and they
because-
actually go and die?
yes,
I'm not cutting you.
yes, because they
They
feel like
actually go
Yeah.
and die
that
because
is the only time they
that's
go.
it.
Because
emergency, you
yeah.
are there. The last time I was on different media station, and the presenter was chastising health professionals, especially the nurses, that, oh, when they come, they'll be fidgeting on their phones and they'll be. I said, no, it's not like that. You see, when you come to emergency center, we call something triage. Okay, so we triage our patients. So, for instance, here is a hospital, is an OPD or is an emergency. So Patrick will come with probably RTA, road transport accident. He's bleeding, profusely. Somebody will come with abdominal pain. Oh, me yem. We will not attend to the abdominal pain, that person. You will seek to the person who is bleeding.
Yeah.
So that's how we do at emergency.
Okay.
So if you stay at home for your condition to, travel to that end, and then you go and you don't get that attention that probably you were looking for, then you might be disappointed.
Yeah. Yeah, I
Which
see what you mean.
Shouldn't be so.
I see what you mean.
You
so
should
the
be
wellness care
proactive.
is very important for us.
That is it.
Also because, because of doctors' notes, I've been having conversations with a couple of doctors every now and again. And one of the things that they talk about a lot is Ghanaians love to self-prescribe.
Exactly.
Yes. Medication to themselves.
Yes.
Like
yes.
When I have a headache, I just go to the nearest pharmacy and tell them that I want to buy this.
Everybody is a health worker here. Everybody.
And even prescribe antibiotics for themselves. These days, because of Google, people can Google symptoms and Google medication and just go and buy it.
I fight with them all the time at my consulting. Please don't bring your Google medicine to my consulting room.
Right.
Google medicine is different from what you have done from clinicals, from the training. Okay? So if you have a problem, you've Google it at Google. Anybody could put anything at Google. Anybody at all could put it there. So they come and they say, oh, I Google it and it's like this. I say, please. If you know, then you have to go and treat by yourself.
Also because a lot of symptoms mimic each other.
It's like that. Every condition. I had a client which came and they were actually treating kidney disorder. Meanwhile, it was a liver cancer. Can you imagine that? Because they've Googled, then realized that, okay, if you have kidney problem, you have pedal edemas. That's your leg gets swollen. Your abdomen begin to bloat. That's so you have ascites. You have, so because they saw that, then they started cooking some plants, cooking some herb. And then when they went to one of the biggest facilities in Ghana here, they went there to say they have kidney problem. I don't know whether that the doctor too didn't do the due diligence and then started managing kidneys. Yes, so the swollen, the edemas were there, the abdominal swelling were there. So somebody directed them to my facility. They came. I listened to them. I am the type who always think outside the box.
Yeah.
I don't just listen to you and then I always think outside the box of what I hear from my clients. So I said, okay, fine. You've been treating kidney problem. He said, yes. I said, so how have you been doing? I mean, you've been given medications to manage the kidney disease. And then I ask, what is actually wrong with the kidneys? Because we have other conditions. We have conditions like kidney stones. We have cysts in the kidneys. We have other pyelonephritis that could actually destroy the kidneys. So in your case, what is causing your kidneys to damage? He said he doesn't know.
Wow.
Right. So I said, okay, then. So we did a couple of tests to do. Nat, I did the kidney function test, and the kidney was so fine.
Oh, right.
The kidneys were so fine, but liver was fat. Almost 3 out of the 4 of the liver strength were gone.
Oh, right.
So these are some of the things you are talking about. So wellness, when you talk about wellness clinic, we don't want you to get the condition before you go to the hospital. Start now. Start now. When you are fine, that's where you begin to see your doctors. That's where you could ask questions. That is where you could act on your right senses.
Right.
That's now, if you are having severe chest pain, dizziness, and then you come to me, anything I suggest, you will do.
True.
Anything I suggest, you do it.
I don't even ask questions
You don't ask anything.
because I just want to feel better.
Exactly. But when you come with healthy mind, no pain, sound mind, then I say, okay, Nat, let's go and do liver function test. Let's go and do kidney function test. Go and do a chest X-ray for me. So you come with all your results, and then I say, oh, Nat, your enzymes, your liver enzymes, probably your gamma glutamate transferase supposed to be maybe 80, and yours is 90. Then you can say, okay, so daddy or doctor, what is causing?
Yeah. What do I do?
What do I
we do to make it better?
You understand? When you do your renal function test and then the parameters, your potassiums, your calciums, creatinine, urea, all these things supposed to be in normal shapes or normal figures, values. But then yours, you have probably low, you have highs, and that's, oh, now your EGFR is this, which is supposed to be like that. Then you could ask your questions and then find a better solutions to it.
Interesting. So essentially what you're saying, Doc, is that we should, from time to time, go and get tested.
You should be proactive
Proactive.
in our health.
Okay. Now, what are some of the tests that typically, let's take an adult between maybe the ages of 30 to 50. Typically, what are some of the tests that you would say are important to take?
You are actually in the spirit. That's a very good question. I mean, I'm sure somebody wanted to ask this question.
Yeah.
That's all. Which are some of the tests that when you are in certain age bracket, you're supposed to be doing.
Yeah.
So at Healthy Soul like this, our place, we have packages when you are 18 years to 35 years.
Okay.
There are certain labs that you're supposed to be doing every year, and that age bracket is when you are exuberant.
Right.
If you're a guy, you have so many friends. Some are platonic, some are intimate, and so
you have the energy.
So you are 18 years to 35. You need to do the STIs, all the STIs. If you are not scared, you should be doing HIV. Yesterday, I was talking to a young lady. She's 25 years. She came. And so, actually, HIV is not part of the package, but then I suggested it to her. He said, doctor, our pressure with the make of to me.
She's afraid.
Yeah, easy. So when you are, back to your question, you are 30 to 55 years or 50 years. You have to know your state of your diabetes mellitus. So there's something we call random blood sugar and then fasting blood sugar. Then there's something we call glycated hemoglobin. Now, medicine is the language.
Right.
If you know Greek, you know Latin, and you understand English, then medicine becomes very simple for you. So when you say glycated, gly means sugar.
Right.
Cated means coated. Hemoglobin means blood. Okay. So basically, when we say go and do glycated hemoglobin,
sugar-coated blood.
Exactly. On your red blood cells.
Right.
And they are in percentage. It's supposed to be from 4.0 to 6.0% in every 3 months. However, there are other situations that could affect negatively or positively on the glycated hemoglobin. When you have too much infections in your body, it could affect your HbA1c. When you are anemic, it could also affect your HbA1c. So it will inform us, we the health professionals, to know that, okay, you don't have diabetes in your family. However, your HbA1c is elevating or is going high. So let's go and check infections. Let's go and check if you're anemic. You also have to check your kidney status. That's if you're 30 to 50 years. It should be mandated for you. If you can't do it every quarter, do it twice a year or once a year. If you have not had any history that, your kidney is under pressure. Because that is what they tells us.
Yeah.
I don't know where they actually get their first diagnosis. I had a client this morning. He said he did a kidney function test. He's actually 45 years. He did a kidney function test, and they told him his kidneys are under pressure. And I said, that was not a good work. Under pressure, how? because we do renal function tests. It gives us electrolytes. It gives
Right.
us the values of the electrolytes.
Mm-hmm.
Now, if I tell you, Natalia, your kidneys are under pressure,
Mm-hmm.
which one? Which
Yeah. Yes.
which type of pressure is it under? Is it your calciums which are low? Is it your potassiums which are low? Is it your sodium bicarbonate which are higher? Is it your creatinine? So I'm supposed to be able to explain all this to you.
Yes.
But if I just tell you that your kidneys are under pressure, what kind of a work is that?
Yeah. Is it that people don't ask questions, or is it that the doctors don't take their time to explain? Because sometimes I've been, and I ask a lot of questions. Maybe by virtue of what I do for a job, I'm always asking questions.
Because you meet doctors a lot.
Exactly. So when I go to the hospital, sometimes I can feel that the doctor is beginning to get upset with the many questions I keep asking.
Most of them get upset.
Yeah.
Most of them.
Yes, I can tell,
Yes.
but I don't stop because I mean, if it's about me and my health,
It
I
is
need
only
to know.
here that doctors get upset when you try to ask questions. Over
Yeah.
there, out there is not like that.
Yeah. So I ask a lot of questions because sometimes you would be ill. I've had a situation where a former colleague of mine was unwell, went to the hospital, came back to work 2 days later, and I asked, so what was it? What was going on? And they said, oh, nothing really. They just gave me this medication.
How?
And I said, hold on. They didn't tell you what was wrong with you, but they gave you medication. The medication is for what?
what?
Exactly. You know, I said, oh, man, the doctor said I should take this, come for review in 2 weeks. I said, no. That should not be the case.
So
but I see that's very typical in
That's why
hospitals.
your program must be propagated. You know,
Right.
a lot of people must listen to what
Yes.
you're doing.
Yes, absolutely. Because people
That's-
need to know.
You have to know.
And sometimes when doctors, prescribe medication, they don't even ask if you have any allergies
Yes.
or whatever.
There's something we call G6PD, glucose 6 deficiency diseases or
Yeah.
defects. Okay, if you have these things, or if you don't have that glucose 6, there are certain medications like sulfur, you can't take them. And this
Right.
is causing a lot of havoc, especially the herbals. You see,
And people don't know.
People don't
and
know.
people don't ask questions.
You see, when you have this condition, the G6PD defective, if you are a patient who are G6PD defective, you are not supposed to take things or medications that thinner your blood. That will make your blood thinner.
Right.
And certain herbals, you are not supposed to drink them. Certain foods, you are not supposed to, or spices, you are not supposed to eat them. But how many people are being previewed? How many people are privileged to go to the hospitals that they be checked whether you have GSSPD, unless you're
Yeah.
pregnant or unless you have gone through maternity,
Yeah.
because that one is one of the mandatory laboratory
yeah.
request tests that you need to do.
That's,
So
that-
back to
that's-
your
yeah.
question again. So from 30 to 50, there are a lot. When you come to Healthy Story, we have about 14 lab tests that you're
Right.
supposed to be doing. If you
Okay.
can't do them every year and you don't have any known medical condition, at least do once in every 2 years.
Yeah. Or you can do them step by step.
Exactly.
You can take care of the sugars
Yes.
maybe this month, and then
Yeah.
maybe before the end of the year, go
Yes.
and do
Yes.
the kidneys, and then maybe next year you do another group,
Yes.
so that you keep going.
Exactly.
You know.
And there's one imperative laboratory investigations that we are not downplay it, which is the cholesterol.
Cholesterol.
Lipid profile. Lipid profile.
Right.
It's a silent killer. It's a silent killer.
Right.
It will actually cause a lot of havoc, especially with all your heart. So when you look at the cholesterol parameters, we have the total cholesterol, you have the LDL, which is the low density lipoproteins, we have the high density lipoproteins, we have triglycerides, we have chylomicrons, then you have the coronary risk ratio. So you need to calculate all these. So
Right.
you will go to a facility, then they tell you that, look, your parameters are fine, but then they can't calculate the coronary risk ratio for you.
Right. Right.
I've had cases that all the parameters, the cholesterol parameters were normal, yet coronary risk ratio was high. Patient kept complaining chest pain. And when he came, he said, Doctor, I have done all the tests. I asked, have you done cholesterol? He said, yes. Oh, then he pulled the lab results. So then he showed it to me. Cholesterol was less than, I think it was 5.2. In my place, the threshold should not be more than 5.2. His case, it was 5.2 exactly. And then...
So he's right on the line.
Exactly. So for me, I'll start managing it because it's on the borderline.
Yeah.
Yes. But where he came from, they didn't do anything about it. And then triglycerides should not be more than 1. He had 1.2. So we took all this. I asked my lab technician to calculate the coronary ratio. And then it was 4.6. Coronary ratio is supposed to be less than 4.
Right.
So
then
thereby
that's a problem.
causing the chest pain.
That's a problem. All right. So I'm sure we would have further conversations because I want to believe that, especially in the coming week, we will definitely have you back because we need to have further conversations. But tell us again where you are located.
Well, Healthy Soul Medical Center, we are at Kanishi. When you are from Circle, after the 2 footbridges, just on your right-hand side, you will see the Metro Mass buses. They are loading to Unibar, Cape Coast.
Okay.
Yeah, they are just in front of my facility. You will see a very big building, Healthy Soul Medical Center. We work from Monday to Saturdays. By Monday to Friday, we close at 5 p.m. And then Saturday, we start work at 8 and close at 2 p.m. Yes. So probably if you want to communicate to me if you have any lab tests. I always say that the interpretation of the lab results is important.
Yeah.
It is important. If you have a medical doctor, if you have a professional healthcare giver who can't interpret your lab results to you, please change the facility. He might be as good as whatever. If he's not able to interpreting your lab results very well for you, that you haven't gone to medical school, you haven't gone to any training to understand
what it is,
then please change it. So you could actually call me on 0243 768 216 0243 768 216. You could follow me on all the social media handles. Facebook is Healthy Soul Medical Center. YouTube, Healthy Soul Medical Center. More videos are there. And then TikTok is Dr. Owusu-Ansah. Some of my videos, some of the things that we have spoken about are there. It would be there as well.
Follow. We'll definitely have you again next week. We need to have further conversations about some of these tests and why they are very, very important. Thank you, Dr. Owusu-Ansah.
Thank you for
having me. And I'll definitely pay a visit. I need to come and check this and that to be sure that... to be sure that everything is okay. We appreciate your time on The Zone this morning. So yes, this is The Zone on Star 103.5 FM. My name is Natalia. Doing this with the man, MJ. Big shouts going out to my producer, Mr. Park. Do stay tuned. We will be